Okay, so heart and pulse rate. And just to go back a little bit, so one of the most important things is for hypertension or blood pressure in general is water. Um, Water can control your blood pressure more so than any other medication can. And dehydration, like we highlighted here, is a cause of low blood pressure. But dehydration can also be a cause of high blood pressure as well. And we discuss that when we get to water as well. So this is just a highlight that today you drink as much water as you can, especially those who may have high blood pressure. But even those who don't have high blood pressure, water is very important for the body. And we'll talk more of that when we get to the water from the New Start principles. Heart rate and pulse. The heart rate is, your pulse rate is the rate at which your heart beats. The strength and rhythm of your heartbeat can also be noted, as well as if the other vessels feel hard or soft. As your heart pumps through your body, you can feel a pulsing in some of the blood vessels close to the skin surface, such as your wrist, your neck, and upper arm. So you can try this. You can put your hand on the thumb side, close to the thumb side of your hand or your wrist, and you can feel your heart pulsing. That is just how fast and how forceful your heart is pumping, and that is your pulse rate. You can, within 60 seconds, if you time it within 60 seconds, you can get the amount of beats per minute that your heart is pumping. So again, your heart rate or pulse is the number of times your heart beats per minute. Normal heart rate varies from person to person. For instance, if you're newborn, heart rate can be 120 to 160. If you're a baby, 1 to 12 months, 80 to 140. A baby or a toddler, 1 to 2 years old, 80 to 130. A child, 7 to 12 years, 75 to 110. Adults, 18 years or over, 60 to 100. Adult athletes, when they're not exercising, they have low resting heart rates. So a Usain Bolt, for instance, may have I'm only saying Usain Bolt because I'm from Jamaica. So you can add your own athlete to the list, but they have resting heart rates that are lower than the average population because of the strength of their heart. Their heart doesn't need to pump that much to get the blood from one area to the next. And at resting, when they're resting, their heart rate is much lower. Heart rate, pulse rate. Why do we check heart rates or pulse rates? So changes in heart rate or the rhythm, a weak pulse, for instance, or a hard blood vessel may be caused by heart disease or other problems. So we can know or figure out what is the cause, or we can figure out that this person has a disease or an illness that is causing the blood pressure to be low or too high. Causes of low heart rate. Bradycardia. It's called bradycardia or slow heart rate. Changes in heart rate as a result of aging. Aging diseases and that damage the heart's electrical system. The coronary artery disease, heart attacks, endocarditis, myocarditis, conditions that can slow the electrical pathway in the heart, hypothyroidism or electrical imbalances such as too much potassium in the blood. Again, the kidneys will get rid of potassium, so your heart can work properly. Medications, antidepressants, heart medications, opioids can also lower your heart rate. Causes of tachycardia or fast heart rate. Anemia can cause an elevated heart rate. Exercise obviously can cause an elevated heart rate. Fever can also elevate the heart rate. Medication side effects, hyperthyroidism, hypertension can elevate the heart rate. Smoking, drinking too much caffeine, alcohol, etc. I would say drinking not too much, but any caffeine, alcohol can increase that. Symptoms of bradycardia or low blood pressure, low heart rate, fatigue or feeling weak, dizziness or lightheadedness, confusion, fainting or near fainting spells, shortness of breath, difficulty when exercising, cardiac arrest in extreme cases. So these are symptoms of bradycardia. Symptoms of tachycardia or high heart rate, shortness of breath, lightheadedness, rapid pulse rate, heart palpitations, chest pain, fainting, or syncope. These are symptoms of tachycardia. And body temperature. So again, it's very simple. You can have a watch. You can count to 15 and multiply the amount of beats by 4. You can count to 30 seconds and multiply the beats for 30 seconds by 2, and you will get the amount of heart beats per minute, and that's your heart rate. Or you can just do the full 60 seconds. So you can try this at home. You can hold your carotids here, or close to your carotids, and you can feel your pulse here, or you can the wrist as well. You can feel the wrist, and within 60 seconds or 15 seconds, once you get those beats, multiply them by 4. So the carotid arteries are the arteries that leads to go to the brain, and they have the same pulse of all the arteries of the body that leads blood away from the heart to the body. So you can measure any arteries that you have. Femoral artery, they will have the same pulse pressure, same pulse from pulse pressure from the heart leading to that organ. So you can get the heart rate from those arteries. What's the body temperature, and what is normal and what is abnormal? So it's important to understand that we have a lot of things regulating our temperature. We have the skin, for instance. We have the capillaries. We have muscles, for instance. We have a lot of hormones can regulate our temperature. But again, it all starts in the brain. The brain is a control center. So from abnormal to normal, we have a lot of different organ systems helping us to maintain our temperature. And it's important to maintain our temperature because we have to tightly control our temperature, what is called thermoregulation. Basically for our surroundings, for us to acclimate to our surroundings, for us to be in a cold environment, our bodies will shiver, for instance, just to maintain an internal core temperature. And without that internal core temperature, our bodies cannot maintain this function. We cannot make proteins, we cannot make the normal physiological functions of the body. So we have to maintain a certain temperature. And if we cannot maintain a certain temperature, then we will die. If it's too hot, we will die from heat exhaustion, for instance, and if it's too cold, we can die from hypothermia or freezing temperatures. So a healthy body functions best at an internal temperature or internal core temperature of about 98.6 degrees Fahrenheit or 37 degrees Celsius. That's a healthy body, and tries to maintain that temperature so that you can function properly. But everyone has their own individual body temperature, which may be slightly higher or lower. So that is the average. 98.6 is the average, of 37.6 degrees Celsius, the average. But people can have a lower blood temperature, or body temperature, or even a higher body temperature. So it's good to know your baseline. And you can do this simply by buying a thermometer and measuring your temperature daily at the same time. And you can know your baseline. So sometimes we can do patients a disservice by saying, oh, this person has a fever, when, or this person doesn't have a fever, when they have, they're coming up from a lower temperature, going up to a higher temperature. This person may have a fever even at 100 degrees Fahrenheit, whereas someone who is 98.6, they would be considered a fever because they're closer to the mark of 100 degrees. But if I'm coming from a 95 degrees Fahrenheit and going up to 100 degrees Fahrenheit, that would be considered a fever. So medicine on that standpoint, just if you think about just the average alone, you can miss certain things, certain aspects of the person's illness from not knowing where the person's baseline is. So it's important to know your baseline, and it's important to know that people have different body temperatures. It might be higher or lower than the baseline or the average baseline. And also our bodies constantly adapt their temperature to environmental conditions. So if it's cold, we're going to shiver. If it's hot, we're going to sweat. So also it goes up when we exercise. Our temperatures goes up when we exercise, and it's lower at night when we sleep, and higher in the afternoon than in the morning. So there's different conditions, different environments that our bodies try to regulate our body temperatures when we sleep, when we exercise, so forth and so on. And there's different ways to measure our blood pressure. Oh, sorry, temperature. I think I love blood pressure this morning. I'm saying it for everything. Excuse me for that. But there's different ways to measure our temperature. Of course, we all know the oral temperature way of measuring our temperatures, oral temperature measurements. And that's normally 98.6 degrees Fahrenheit. If you measure under the armpit, it could be 96.6 degrees Fahrenheit to 98 degrees Fahrenheit. And these are the variations. So you may not get a 98.6 under your armpit, for instance, but if you're doing this under the armpit, just know that this is the variation from 96.6 to 98 degrees Fahrenheit. Or the rectal measurement is 99.1 to 99.6, and this is based on the heat coming from the area. So from the mouth, the best you can get from the mouth is 98.6. From the rectum, 99.1 to 99.6, because you're more so close to the internal temperature of the body. And from the ear, again, 99.1 to 99.6, you're more so closer to the internal temperature of the body, or closer to the heat that's coming off of the body. So why do we check body temperature? Body temperature is a measure of the body's ability to make and get rid of heat. The body is very good at keeping its temperature within a safe range, even when temperatures outside the body change a lot. So we have a lot of systems in our body: the endocrine system, the nervous system, the integumentary or skin system, the muscular system, other systems that play a very important role in regulating the body's temperature, because it's very vital for us to maintain our core temperature so our body can produce or function properly. Produce certain proteins and so forth and so on, you need certain temperature. For our bodies to function properly in doing these things and creating energy, the body has to be a certain temperature. So when we check the body's temperature, we are able to detect fever, hypothermia, or low body temperature. Hyperthermia, people who have been exposed to heat. Check the effectiveness of a therapy treatment, and to determine if you are ovulating, thereby increasing the probability of becoming pregnant. So these are different ways we can, why we check body temperature. So hyperthermia, or a high body temperature, is officially a fever. Officially, a fever is 100.4 degrees Fahrenheit or greater. So whenever your body temperature is 100.4 degrees Fahrenheit or greater, that's 100.4, not 104, 100.4 degrees Fahrenheit or greater, then you have high body temperature. And this leads to sweating, chills, headaches, muscle aches, loss of appetite, irritability, general weakness, dehydration. You know, if you've ever had a viral infection or a bacterial infection or heat exhaustion, these are the things that happen when you have, these are the signs and symptoms that happen, that occur when you have, when your body temperature is greater than baseline. But you can also have these conditions when you have autoimmune disorders like rheumatoid arthritis. You have tumors. Cancer can cause high body temperatures. Medications as well, immunizations as well, as other things can increase. Exercise in the heat can cause hyperthermia, and a lot of children die from hyperthermia when they're exercising on the football field or things like that. Hypothermia, less than 95 degrees Fahrenheit, is considered hypothermia, or low body temperature. Shivering is important, but if in hypothermia it becomes severe, the person might actually stop shivering. Clumsiness, trouble speaking clearly, confusion, feeling tired, breathing faster than usual, urinating more than usual. These are signs and symptoms of hypothermia. Causes of hypothermia or low temperature: environmental exposure, shock, infection, metabolic disorders such as hypothyroidism, adrenal insufficiency, and Wernicke encephalopathy. Wernicke encephalopathy can be caused by a lack of vitamin B12, for instance, or B vitamins, B1. I'm sorry, B1, not B12, B1, vitamin B1. Malnutrition, and alcohol and drug toxicity. Respiration rate. Respiration rate is very simple. Basically, respiration rate is the number of breaths a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths for 1 minute by counting how many times the chest rises. So for 1 minute, how many times the chest is rising? This is the respiration rate. So why do we check the respiration rate? Respiration rate is a clinical sign that represents ventilation. How well is the body being ventilated? Or how well is the body getting oxygen? A change in respiration rate is often the first sign of deterioration as the body attempts to maintain oxygen delivery to the tissues. So if my respiration rate is too high or too low, I'm not getting sufficient oxygen to my tissues. The normal respiration rate for an adult at rest is 12 to 20 breaths per minute. So 12 to 20 breaths per minute in 60 seconds, that's the normal respiration rate. A respiration rate under 12 or over 25 per minute while resting is considered abnormal. Again, that's at resting. When I'm exercising, for instance, my breathing rate is going to go higher. My respiration rate is going to be higher. Causes of decreased respiration rate or bradypnea. Bradypnea is lower respiration rate. Some causes are uremia, increased intracranial pressure, excessive sedation, such as alcohol intoxication, sedative hypnotics or benzodiazepines, illicit drug use, opioid, heroin, morphine, etc. Sleep apnea can cause bradypnea. Stroke that affects the lower brainstem. So at the lower brainstem, you have an area that controls your respiration rate. So again, the brain is the control center. It can control how much your lungs fill up with oxygen. And for instance, when you're sleeping, your brain, the lower brain stem, the brainstem actually controls your breathing rate. You're not actively controlling your breathing rate. The brainstem does. And it's all, again, for oxygenation. You see here on the picture, the more we respirate, the more alveoli from the lungs that we recruit, the more oxygen that goes into our blood, and the more carbon dioxide goes out from the blood into the lungs to be expelled out of the mouth or the nose. The causes of tachypnea or rapid respiratory rate is called tachypnea. These things such as diabetic ketoacidosis, pneumonia, COPD, asthma, allergic reactions can cause tachypnea or a rapid respiratory rate. And when you have a rapid respiratory rate, you're not able to exchange the gases, the CO2 and the oxygen, to allow for proper ventilation. Ventilation, again, is getting the proper amount of oxygen that my cells need to operate. Some highs and lows. What are some symptoms of dyspnea or a decreased or bradypnea or a decreased respiratory rate? Lightheadedness, feeling faint, dizziness, chronic fatigue, headaches, weakness, confusion, poor coordination, chest pain, memory problems. These are the causes of a low respiratory rate, or dyspnea or bradypnea. So what are some causes of high respiratory rate or tachypnea? Muscle cramps, dizziness, confusion, extreme thirst, headache, sweating, fainting, unconsciousness, nausea or vomiting, high body temperature, seizures, a lack of sweating, even though the person feels hot. So these are some symptoms of tachypnea or high respiratory rate. How about blood glucose? Blood glucose is not a quote unquote vital sign, but it's taken as an important way we can see if the person is ill or not, from not just from diabetes, but for instance, in the emergency room, blood glucose is taken when someone is unconscious, because this is when our body is not able to make energy from glucose. This is one way that we can become incapacitated or we can lose consciousness. So blood glucose is as an important way we can measure if the body needs energy. So what is glucose? Glucose is basically blood sugar. It's the main sugar found in our bodies. It comes from the food you eat and is your body's main source of energy. Your body carries glucose to all your body cells to use energy. So glucose is very important for our brain cells, our heart cells, our kidney cells, our skin cells, every cell in your body uses glucose, a quick source of energy. So this is basically a blood sugar chart. Fasting, your fasting blood glucose. So for instance, you get up this morning and you measure your blood glucose levels. It should be between 70 to 90. That is average. Some charts with 70 to 99, but we like it to be 70 to 90. Official ADA recommendation for someone with diabetes, 80 to 130. That is should be the regular the blood glucose levels for someone with diabetes. Anything higher than that is considered detrimental. 2 hours after meals, a normal person without diabetes, 2 hours after meal, 2 hours after a meal, that is. It should be less than 140. So less than 140, 2 hours after a meal is normal. For a person with diabetes, less than 180, 2 hours after a meal is considered normal. How about, and we'll talk more about hemoglobin A1C. I won't touch upon that, but hemoglobin A1C is another way of measuring blood glucose. We'll talk more when we get to the blood work. Blood glucose. Why do we check blood glucose levels? Blood glucose test measures the glucose levels in your body. Glucose is a type of sugar. Again, it is your body's main source of energy. A hormone called insulin helps move glucose from your bloodstream into your cells. We spoke about this before. The insulin is very important. It is almost like a lock and key. The insulin acts like a key. It goes to the cells, it unlocks the door, and glucose is able to go into the cell. Too much or too little glucose in the body and the blood can be a sign of serious medical condition. Cause of increased glucose levels or hyperglycemia, diabetes, kidney disease, hyperthyroidism, pancreatitis, pancreatic cancer, trauma, brain injury, infections such as pneumonia, UTIs, medicines, steroids, diuretics, so forth and so on. So some medications that you're taking, or you may be taking, or someone may be taking, they can cause high blood sugar levels.
And causes of decreased blood glucose levels or hypoglycemia, too much insulin, diabetes medications, excessive alcohol drinking, severe illness, cirrhosis, hepatitis, kidney disorders, insulinomas. These are basically cancer cells, and insulin that's in the pancreas that produces too much insulin. When that happens, your cells take in more glucose than it needs to take. Long-term starvation or anorexia can cause hypoglycemia. Causes of increased glucose. Symptoms of increased glucose levels or hyperglycemia. Early signs of hyperglycemia: frequent urination, increased thirst, blurred vision, fatigue, and headaches. Late signs of hyperglycemia: fruity smelling breath, nausea and vomiting, dry mouth, weakness, confusion, coma, and abdominal pain. So abdominal pain. So a lot of teens type 1 diabetes. This is the first sign or first complaint of teens or young adults who have type 1 diabetes. They have hypoglycemic events, they have abdominal pain. How about hypoglycemia or low blood glucose, irregular or fast heartbeat, fatigue, pale skin, shakiness, anxiety, tingling, and numbness of the lips, fatigue, irritability, and hunger, even down to the point of losing consciousness. How about oxygen saturation? Oxygen saturation is important. How well are our tissues being perfused with oxygen? Like I said, every tissue needs oxygen, or cell needs oxygen. So why do we check oxygen levels? Pulse oximetry is a test used to measure oxygen level, oxygen saturation of the blood. It is an easy, painless measure of how well oxygen is being sent to parts of our body furthest from the heart, such as the arms, the legs, or the brain. A pulse oximeter is a probe on the finger, or could be in the ear as well in the hospital. They have a light emitting diode or LEDs, which shines two types of red light through the tissue. And this sensor on the other side of the tissue picks up the light that is transferred through the tissue. From this, you can pick up the oxygen, the amount of oxygen that is being received in the body. The oximeter, the pulse oximeter, is basically this device at the bottom of the screen, is a pulse oximeter. They can determine which of the hemoglobin is in pulsatile blood, arterial blood, and can then determine the partial pressure of oxygen of arterial blood in the peripheral circulation. The following factors listed can alter pulse oximeter readings. So dark colored nails. So if you're taking someone's oxygen saturation levels, for instance, make sure they don't have dark colored nail polish. You're going to read a lower SpO2 or oxygen saturation because of dark nails. Cold fingers or poor circulation. You've got to make sure the person has good circulation for them to have a good measurement. Tremor or movement. That can also affect the recording or reading. Too much pressure on the probe, low blood pressure can also cause it. So these are certain things that can affect the levels that you get from the pulse oximeter. So a normal SpO2 or oxygen range from the pulse oximeter is more than or equal to 95%. So that is considered normal for normal individuals. For normal individuals with COPD, or this is a lung issue, is 88 to 92. When someone is hypoxic, that means they have very low oxygen saturation, 85 to 94. And for instance, when people had coronavirus issues, their SpO2 ranges were lower than 90. They were lower than 90. They had to go to the hospital to get better treatment. Either to put on a oxygen mask, or if you're lower than 70, for instance, with a ventilator machine. Severely hypoxic, less than 85. And when you're less than 85, they want to put you on an oxygen, put you on supplemental oxygen, either a mask that gives out oxygen, or when you're lower than 60 to 70, that's when they want to put you on chemical ventilation. I'll answer the question. So hypoxemia or low oxygen saturation. COVID-19 lung conditions such as, or some causes, COVID-19 lung conditions, asthma, emphysema, bronchitis, locations in high altitude, strong pain medications that slow breathing like morphine, sleep apnea, pulmonary fibrosis, heart of the lungs, anemia, general heart defects can cause low oxygen levels and hypoxemia. In closing, scripture from Proverbs 3 verse 1 and 2 says, "My son, forget not my law. Let thine heart keep my commandments. Length of days, and long life and peace that we have today." But we always forget. Sometimes we focus on the physical aspects of life and our vitals, but we cannot forget the law is vital to our life. Without the law, we have no life. Without the law of God, both moral and physical, we have no life. It's important to always remember when we're helping others understand their bodies, we're helping others to see what their vitals are, see what their blood pressure are, always points to God's law, either moral or physical. Always points to the law. We don't have to bash people, beat people with the Bible. We're always in a effective and efficient way, always points to God's law. Any questions? There's one in the chat. Sorry. I'm sorry. I hope that you're able to hear me. Do you want me to repeat anything else? Any slide that you want me to repeat?
You sort of breaking up. I'm not hearing you that clear.
Okay. Much apologies. I'm not sure why that's happening. But if you need me to repeat something, please let me know. Anything that was not clear at all?
Good morning, all.
Good morning.
Okay, so a lot of stuff was dealt with. When a patient has a temperature of like a blood pressure, a blood pressure of like say 105 over 55. How much danger is that patient in?
Well, it
When their
depends.
diastolic is that low.
Well, it depends. People can have low blood pressure in that range and be fine.
Okay, he generally doesn't.
Sorry, say that again.
He generally doesn't have a high blood pressure. He's like on the high normal, but he doesn't have a low blood pressure.
Yeah, so you said 105 over 55.
Yes, or even sometime 89 over 55.
Yeah, so generally, if the person does not have any signs and symptoms of low blood pressure, that person is fine. That's the blood pressure that his body needs for that time. So if the person is not experiencing the signs and symptoms that I mentioned before, like headaches and dizziness and lightheadedness or fainting, then that blood pressure is adequate for that person at that time.
Oh, I forget to say that they were experiencing fever, chills, where they were shaking uncontrollably.
So it could be that the person has an infection. There's something called a SIRS criteria, and basically tells you how severely bad this person is when they have an infection. And one of the criteria is when the temperature either goes up a certain amount or goes down a certain amount. So the person may have an infection in that case.
Thank you.
You're welcome.
Because that was the case.
That the person had an infection?
Yes.
Oh. Any other questions or concerns? I'm sorry that my headset went out in the middle of the presentation, and my computer, for some reason, the microphone is acting strangely. So my apologies. I'll charge my headset next time so you can hear me more clearly. But if you need me to repeat anything, please tell me and please let me know. I'll do that at this time. Or any questions, please let me know.
Could you go over the glucose again, please? Because I thought it was my system acting up.
Okay.
Not realizing it was yours.
Yes, sorry.
Yeah.
Glucose, let's go to glucose. So which aspect of glucose? Or you want the entire thing?
Yes, thanks.
All right, let's do this. So blood glucose is important because blood glucose is the main source of energy in our body. And it comes from the food you eat. So if you eat a mango, for instance, you're going to turn that carbohydrate into glucose from the mango that you ate. Or if you eat some crackers, you're gonna turn those carbohydrates to glucose or different types of sugars that your body needs to make energy. So this glucose is the main source of energy, however, and you can also have storage sites like your liver that stores glucose for energy consumption, and it stores it as glycogen. Your body carries glucose to all of your body cells to use for energy. So your brain needs glucose, your heart needs glucose, your kidneys use glucose, your liver needs glucose. Every part of your body, your tissues need glucose. For someone, this is a blood glucose chart, like I was saying before. I won't go over the hemoglobin A1C for now. I will go over that when we do how to read blood labs, and that is on Thursday. So fasting, a normal person without diabetes, their fasting blood glucose should be 70 to 99, or we like to say 70 to 90 milligrams per deciliters, or 3.9 to 5.5 millimolar per liter. So, for instance, that's the English reading. So in certain places like Jamaica, for instance, they'll use the millimolar per liter reading. But in the US, we use the milligrams per deciliter reading. Official ADA, American Diabetic Association recommendation for someone with diabetes is 80 to 130 milligrams per deciliters, or 4.4 to 7.2 millimolar per liter. 2 hours after a meal, that is 2 hours after you ate, the normal person, normal blood glucose for a person without diabetes should be less than 140 milligrams per deciliter, or 7.8 millimolar per liter. Official ADA recommendation for someone with diabetes, less than 180 milligrams per deciliter, or 10 millimolar per liter. Again, I'm not going to go over the hemoglobin A1C. I'll reserve that for Thursday. Why do we check blood glucose? A blood glucose test measures the glucose levels in your body. Glucose is a type of sugar. It is your body's main source of energy again. A hormone from your pancreas called insulin helps move glucose from your bloodstream into your cells. And insulin acts like a key. It goes to the cell, unlocks a door, and then the door opens and glucose goes into the cell. So again, insulin acts like a key. It goes to the cell, opens the door opens, and glucose goes into the cell. And without that key, the glucose will remain in the bloodstream. So when, for instance, I have a type 1 diabetic that is not making insulin, I measure their blood glucose. Their blood glucose is high because the key is not opening the door so that the glucose can go into the cell. Too much or too little glucose in the blood can be a sign of serious medical condition. So high blood glucose or low blood glucose can be a serious medical condition. And this is all based on homeostasis. Or homeostasis is balance. Our bodies try to balance the amount of glucose in the blood. Causes of increased glucose levels: hyperglycemia, diabetes, kidney disease, hyperthyroidism, pancreatitis, pancreatic cancer, trauma, infections, medicines such as steroids or diuretics. These things can cause hyperglycemia or high blood glucose. For hypoglycemia or low blood glucose, too much insulin or diabetic medications, excessive alcohol drinking, severe illness, cirrhosis, hepatitis, kidney disorders, insulinoma. Insulinoma, again, is a insulin-producing tumor that's from the pancreas, and it produces too much insulin, too many keys for your body needs, and your body does not have a balanced amount of glucose in the bloodstream. That can cause low blood glucose. Long-term starvation as well, such as anorexia, can cause hypoglycemia or low blood glucose. We went over that. Some symptoms, signs and symptoms of hyperglycemia: early signs, frequent urination, increased thirst, blurred vision, fatigue, and headaches. Late signs of hyperglycemia or high blood glucose: fruity smelling breath, nausea and vomiting, dry mouth, weakness, confusion, coma, and abdominal pain. And like I said, for type 1 diabetics, like teenagers, for instance, or young adults, when they have a high blood glucose, that's one of the first signs: severe abdominal pain that takes them to the hospital, and then they're diagnosed with type 1 diabetes. How about hypoglycemia, irregular or fast heart rate, fatigue, pale skin, shakiness, anxiety, tingling, numbness of the lips and cheeks, irritability and hunger, and sometimes, like I said, you're incapacitated or you lose consciousness. And that's it. Oxygen saturation, I don't know if anyone needs me to go over that, but oxygen saturation basically is needed for our cells, all our tissues to be, our body needs to ventilate properly, so our cells, all our cells and our tissues can get the proper oxygen it needs to create energy, to create the things that we need for proper functioning. Any other questions?
Yes, a question. Good morning.
Good morning.
With this being the season of mangoes, and you spoke about mangoes and the
Yes.
glucose. What how much mango should one eat? Because you know, this season we tend to eat so many mangoes. How would that affect the glucose?
If it was up to me, I would say eat as many mangoes as you can. I love mangoes. My favorite, probably my favorite fruit. I want to be in heaven when we have mango season. But to be honest, here on Earth, we have to be careful with what we eat and how much we eat. Of course, everything in moderation, especially the high glycemic foods, the high glycemic fruits like mangoes, pineapple, grapes are high glycemic, papaya are high glycemic fruits. You want to be very careful with those fruits, because, especially if you're diabetic, because they increase the body's glucose in the body. I'm not saying, especially if you're diabetic, not to eat these fruits, but eat less of it. You're going to eat, if you're normally eating one or two, eat half of one or eat just one, because that can increase your blood glucose levels and cause further damage to your body. So, as a medical missionary and not as someone who loves mangoes, I would say try to eat them sparingly. Even if you're not diabetic, eat them. Don't eat buckets of mangoes. Like I used to do back in the day.
Thank you.
You're welcome. Any other questions, concerns? All right. So on Thursday we're going to review. I'll show you what we're going to review. So on Thursday we're going to review blood lab reports. So what you can do is you can, just to follow along, you can bring your if you have recent or past blood reports, You can bring your blood reports, and you can see how to explain these different levels that we have on our blood lab report. So what is a neutrophil? What is a lymphocyte? So on and so on. What does it mean for our body? So you can bring your lab reports, either recent, like I said, or in the past, and you can learn to help others to read their lab reports. All right. If no other questions or concerns, you can have a word of prayer, and then we can close. Brother Bernice, do you mind having a word of prayer? I don't want to the microphone to go out.
Okay, no problem, no problem.
Thank you.
Let us pray. Father in heaven, we thank you once again for another morning, another opportunity. It's all about how you designed this body. You're taking care of it. We thank you. We ask you for your leading, protect us for the rest of the day. We pray in Jesus.
Amen. Thank you. Thank you, everyone. Have a good day.
Yeah, so we'll see on Thursday, God willing.
Yes, Thursday morning, God willing, that's when we will meet again.
Yes, okay, no problem.
All right.
Yeah, thank you. Yeah. Bye-bye, everyone. Have a good day.
Bye.
Bye all.
Bye.
Yeah, bye-bye.
Goodbye, dear.
Hi, everyone. I enjoyed this morning so much. Medical field is awesome.
Amen.
Bye everyone.
Mental health is awesome. I want the rest of this. I wonder if they can do it. Yeah. Turn it off yet? I don't ask.